Now, we've long been told that diabetes is turning into a big problem. Now, the government and NHS England have been accused of being too slow to take action. Over the past 2 decades, the number of adults diagnosed with either type 1 or type 2 diabetes in England has doubled to nearly 3.2 million. And it's estimated that's costing the NHS £5.5 billion a year. As Catherine Jones reports, it's not just the health professionals who are being told to do more to help.
Checking blood sugar is a familiar routine for Liz. A type 1 diabetic for 50 years. It was only a decade ago she got a week of intensive training in how to manage her condition.
Oh dear, that's a bit high.
A turning point that made her realise how vital it is to get specialist support.
There should be a GP in every practice and a nurse in every practice who is well trained in diabetes. I'm terribly lucky to have my annual training updates from the hospital I attend, but I just cry when I see what some people get or don't get. It's just not fair.
Today, the Commons Public Accounts Committee has warned the cost of diabetes will continue to rise because there's poor support for patients in many parts of England. Also a shortage of the specialist staff the NHS needs to treat them. Plus, not enough prevention work is being done to stop people becoming diabetic.
We know what works in preventing and treating diabetes. We want the Department of Health and NHS England to make sure that that's happening everywhere, whether it's hospital or at primary care level. We want to make sure that people are getting help to prevent them developing diabetes in the first place. That's a win for the individual, a win for society and a win for the taxpayer.
The report also reveals that very few new patients are taking up the education being offered to them.
It's a lot to take in, and also the things that we're asking people to do are really hard things to do. So losing weight and exercise more if you have type 2 diabetes is often going against all the whatever everyone around you might be doing, and so people need a lot of support and help to be able to do that.
Nowadays, many diabetics get that support from each other through online forums and websites.
And we all learn from it.
But if the NHS's diabetes services were more comprehensive, patients wouldn't need to rely on this quite so much. Catherine Jones, 5 News.